happened with Optident and Henry Schein is they put everything together into one package. So actually everything kind of flows very seamlessly. I'm very picky about what I use, so I like to try stuff and make sure it works. And what I found is everything's working really nicely, the system works well, and I'm getting great results. The idea of the courses is to take dentists, really at any age, any part of their career, through a totally different process, perhaps what they've been doing before. Yes, we are doing something which is helping patients to have a better smile, and we're doing it in a really simple way, which involves align, bleach and bond, which is a concept that I pioneered many years ago. And I realized over many years that align, bleach and bond isn't just about making your teeth look good now, that actually if you do this, you can have great teeth for your whole life if it's looked after in the right way. So the great thing about this course is we will take somebody who hasn't really done any of this sort of stuff before, teaching them ortho, and we're using the Reveal aligner system, great clear aligner system, that basically is what I like. It has a high finish line, very few attachments, which actually makes it far easier for dentists to use, much more aesthetic, and we're going to show people how to set their cases up. And we're setting their cases up in what we call an ortho-restorative way. It's not just about here's some straight teeth, it's about, well, why do the teeth need to go here, and how is it going to work functionally for that patient? So we teach the aligner system, of course, and then how to execute it, and of course we'll provide mentoring with that as well. Then we'll talk a lot about bleaching and how to whiten the patient's teeth, either with the aligners or perhaps post-treatment, and then particularly how to maintain that case years down the line. And then the day two is more about the kind of ortho-restorative element, where we're going to be using bonding systems to help the dentist actually then create that final part of the Confident Smile Makeover, where they're getting the outline correct. A lot of it we do with edge bonding rather than composite veneers. Now, it doesn't mean you can't do composite veneers, but if you understand align, bleach and bond, you realize that you don't need to do composite veneers most of the time. But the key is to have the right type of material, and which is a material we use in this course, to enable the dentist to create an edge that actually looks completely seamless. So that's something that we teach on day two, and they'll have the confidence to do that. Everyone looks at their work and says, wow, that's amazing, and they can go off and do that the next day. But also what's really important is that they'll be doing that bonding in the context of understanding how the occlusion, the function, and the anterior guidance is going to work, so that they know that that bonding is still likely to be there 2, 3, 5, 10 years down the line. And then the other part of that, the day two, is to teach people how to talk to patients correctly. Now, we may think we know how to do that, but dentists are taught to look at things quite statically. Is there caries? Is there perio? Is there wear? This course will teach you how to think about what's happening in the future. What's likely to happen to the bite? Is it deepening? Is the guidance changing? Is the envelope function going to change? Are you going to lose your anterior guidance? One goal for me in this Confident Smile Makeover course is to actually enable dentists to use this system to stop any patient ever going on to need a full mouth rehab. Because in truth, lots of patients end up needing a mouthful of crowns because no one spotted that all of this stuff was actually going on. You will come away from this course with the ability to actually think, okay, I see that problem, I can talk to my patient about it, I can educate them about it, and now I'm going to have the tools, which could be ortho, it could be just bonding, it could be dial principle, which I also teach on the 2 days, to then give the dentist the ability to go ahead and actually start to implement that to prevent that problem long term. So think about, yes, it sounds like a cosmetic dentistry course, and yes, while we're teaching cosmetic dentistry, this is really about lifetime dentistry. And I think we know the strength of this concept. We teach it right around the world. And quite frankly, it's something that I think everyone should be able to do.